unit, who is leading figure in Sri Lanka's national dengue response efforts, with years of expertise in surveillance, prevention strategies, and public health coordination. His commitment of the safeguarding communities has played a crucial role in national dengue management. And next we have Dr. Mahesh Gunasekara, the Secretary General of the Sri Lanka's Red Cross Society, a signified medical administrator and a humanitarian leader with over 25 years of experience across Asia, Africa, and also in Europe. His expertise spans not just only in the public health sector, but also in disaster response, emergency recovery programs, and strategic health management. Under his visionary leadership, Sri Lanka Red Cross Society has pioneered forward-looking initiatives, including the introduction of the very first simplified early action protocol on dengue, which is designed to empower communities to take actively preventive action based on climate and health data. Ladies and gentlemen, we will now move into the media briefing segment. It's my privilege to first invite Dr. Kapila Kannangara, the Director of the National Dengue Control Unit, to address the media. So please, you may proceed.
Thank you very much for all the people who are gathered here today, all the dignitaries, especially all the dignitaries from the International Red Cross as well as the Sri Lanka Red Cross and the consultants of the National Dengue Control Unit, the media, and others who are here. Well, I think this partnership with the SLRC and the Dengue Control Unit is a significant role in preventing dengue in this very special kind of occasion where we have undergone a huge disaster, and the second disaster that we might face would be a dengue epidemic. So that is going to create havoc with the people who have already undergone severe hardships due to the cyclone that we had a few weeks back, and I think this is a good time to start this program, especially in the 5 districts that we have selected through our coordination. Those are the 3 districts in the Western Province, that's Gampaha, Colombo, and Kalutara, and then we have selected Jaffna district and also Kandy district. So even now, as you know, with the northeast monsoons setting in, northern province, eastern province, and these areas are under threat again for heavy rainfall during the next coming few couple of days. And so this is like the action before, assuming that there are re-epidemic. This is action which is preemptive action, proactive action against what we might expect. And this is also one of the peaks. As you know that there are 2 peaks in dengue for a year, and this is the time that the second peak comes up. And also with this disaster and the rains coming in, we can expect a rise in morbidity and mortality in dengue. So this is to prevent that, and as the Dengue Control Unit, we are also engaged in a lot of work to prevent this, but with the Sri Lanka Red Cross joining in, I think it's a huge asset as well as a huge support for this program, and especially in these 5 districts. So I think that today we are launching this, and the communities in these 5 districts, the school communities, and the general public, and also, as you have seen, we'll be working in places where there is a lot of public movement. So it's very important that these places are looked after, and I think we have in our program various activities which will go on in these communities, which will support the government sector also, the MOHs, especially the RDHs and MOHs, who will also be working on these aspects. So it's an added advantage for them with the SLRs joining in. And also it's very important that while we are proactively doing cleaning up operations and making them aware, it's very important that we give them a sort of health education for all, especially the school children as well as the communities about waste disposal. As you know, dengue is a disease which comes through where the breeding is going on in containers which are being thrown out of kitchens, which are being thrown out of homes. So therefore, it is very important that these children, it should start from the school curriculum and also in the public, that waste disposal, segregation, waste disposal is very important to prevent dengue. So while the curative services are looking after the sick people, already the incidences of dengue, but for prevention it's very important that the environment should be clean, because it's actually an environmental disease. So I think this cooperation between SLRC and dengue control unit, as well as our whole network of public health services in the country, which is the medical officers of health, the public health inspectors, and the rest of the community-based organizations to also support. It's a good network to prevent dengue, especially in these times where the country has gone through some hard times.
Dr.